Nephrotic syndrome is a combination of the following symptoms: high protein in urine, called proteinuria, low serum albumin, or hypoalbuminemia, swelling or edema, and high blood lipids, or hyperlipidemia. Edema is most prominent in the face, feet, ankles, arms, and abdomen. Other signs include foamy urine, poor appetite, and weight gain due to fluid retention. Nephrotic syndrome can be primary, meaning the cause lies within the kidney, or secondary, as a consequence of another illness. The first step in urine formation is filtration of blood, which occurs in the glomeruli of nephrons. In a healthy kidney, the glomerular filtration membrane allows only small molecules to pass through. This membrane has three components: the fenestrated endothelium of blood capillaries, the glomerular basement membrane, and the glomerular epithelium made of podocytes. Proteinuria occurs when injury to any of these components compromises the filtration barrier, allowing plasma proteins to pass into urine. The main protein in blood, albumin, has a negative charge and can leak when the filtration membrane becomes more positive. Leakage of albumin alone is selective proteinuria. Non-selective proteinuria, meaning leakage of all plasma proteins, typically occurs with a more general defect in the filtration membrane. There are two hypotheses for the formation of edema in nephrotic syndrome. The underfill hypothesis states that low blood albumin is the cause of edema, because high blood protein content is the force that draws water from the surrounding tissues into blood vessels. A lower blood albumin would draw less water in, leaving more water out in the tissues. The overfill hypothesis states that edema is caused by an increase in sodium and hence water retention in renal tubules. This is because certain proteins present in the filtrate have a sodium retention effect. As more of these proteins escape to the filtrate, more sodium and water are reabsorbed. This leads to increased blood volume and subsequent increased fluid leak to body tissues. In a compensatory response to low blood albumin, the liver produces more albumin and some other proteins, including lipoproteins, releasing more cholesterol and triglycerides into the blood. This, together with loss of plasma lipoprotein lipase, results in hyperlipidemia. Some of the elevated serum lipoproteins are filtered into urine and can be seen as fatty casts, a key finding in urinalysis. The liver's compensatory response favors production of procoagulants. This, together with the loss of anticoagulant and profibrinolytic proteins, leads to increased blood clotting. Other complications of nephrotic syndrome include infections due to loss of immunoglobulins and edema fluid acting as culture medium for pathogens, hypocalcemia due to loss of vitamin D binding proteins and consequent reduced calcium absorption, and hypovolemia due to loss of plasma fluid to body tissues. Diagnosis starts with a physical examination for presence of edema and its consequences. Diagnostic tests include urine tests for protein content and presence of lipid casts, blood tests for serum albumin, creatinine, cholesterol, and autoantibody against phospholipase A receptor, a protein on the surface of podocytes. Presence of this antibody is associated with primary membranous nephropathy. Blood tests may also identify some secondary causes. Ultrasound can detect renal scarring and fibrosis. Renal biopsy may be indicated for some cases. Treatment varies depending on the cause and may include corticosteroids to treat inflammation and autoimmune diseases, Steroid-resistant or steroid-dependent cases may require other immunosuppressive and/or anti-inflammatory agents. Antihypertensive agents to lower blood pressure, hence reducing the force that drives filtration of proteins. Diuretics to treat edema, but patients must be closely monitored to prevent volume depletion. A low-salt diet can also help limit fluid retention. Statins to lower cholesterol. Anticoagulants to treat or prevent blood clots. And antibiotics to prevent infections.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.